COVID restrictions are due to be partially lifted this Friday after days of wrangling at Stormont. But have the measures been enough to alleviate pressures on the NHS?
Do I think it's enough? No. Will we be looking for more? Will we come back to the executive probably before Christmas or the New Year asking for more steps? I firmly believe we will be.
Tonight on Spotlight, we assess the impact of the second wave of coronavirus on a health system already stretched to the limit.
This is the worst I have ever seen in my 35-year career. In this next 3 to 4 weeks before Christmas, we have a medical nightmare to deal with.
5 hospitals in Northern Ireland are currently exceeding capacity, and patients are waiting hours to access a bed.
Yeah, we've had patients 8 hours in an ambulance waiting outside A&E to get in. A&E's that busy that it's one in. We can only put one in when they get one moved out.
We investigate the working conditions of staff across the sector.
There are conversations being had about mandating nurses to move, and let's not dress that up. Mandating means forcing nurses when they say, I do not feel comfortable about moving there.
And one NHS worker transferred to the COVID front line at Belfast's Nightingale unit speaks out.
The support nurses are on their knees with anxiety regarding the whole situation.
It's a bitterly cold Friday night, with hospitals operating close to or at capacity. We're following an ambulance crew in the second wave of the pandemic. 2 minutes into the shift, and there are already 2 call-outs. Paramedics Neil and Richard are responding to an emergency in Cumber, where a 71-year-old woman has fallen in her home.
What's that number in your left? We're all around the corner. I'll recognise it. Do you know it? Yeah, it's where the next road turns up. It's the very corner house here. With the light on there. Yeah.
It's the second time in a week paramedics have been called to the house.
So we've just been told that the lady is presenting with COVID symptoms. Also that a person she has been in close contact with has now been diagnosed with COVID and is already in hospital.
The patient was found by her daughter Julie, who herself has just come out of quarantine with COVID. Days earlier, Julie's 80-year-old dad suddenly became very unwell. He was taken to hospital, where he is also being treated for COVID.
Julie, thanks so much for talking to us. Your mum is just leaving now for hospital. Can you just tell me what's happened?
Dad was ill a couple of nights ago and sort of fell down the stairs, and he's ended up in Downpatrick Hospital and he's been diagnosed with COVID. So it's very worrying, because with Dad the other night, I couldn't go down because I was still in quarantine. I felt so helpless. Mum had to deal with it, even though she wasn't feeling great. And then tonight, when I came down, I couldn't get in. Both doors were locked. I could see her in the chair, I could see her vomiting. So I was able to go around the back and get ladders and climb in the living room window. I rang the ambulance and waited for the crew to come, and they've got her now and they're going to take her away. It's horrendous, absolutely horrendous situation to be in.
COVID has basically ripped right through your family in the last few weeks.
It has indeed.
Julie's mum was taken to the Ulster Hospital, which has been operating at full capacity for the last week. She was admitted within an hour of arrival. But when Julie's dad was brought here 3 days earlier, there were no beds available. After 36 hours in the emergency department, he was transferred to the Down Hospital, 23 miles away.
It's an extraordinary situation that you've got 2 elderly parents, both in separate hospitals. I mean, you're still obviously have got this, recovering from COVID.
Yes. I'm in quandary now whether to tell Dad Mum's in hospital. I don't want him stressing. And I know as soon as my dad heard COVID, he said to me on the phone, he says, I'll not get out of here. I says, Daddy, listen, he says, I'm 80, I'll not get out of here. And I says, no, you will. You will. I want to see you again. Now, come on.
It's still early evening and ambulances are backed up. Hospitals are struggling under the pressures of extremely ill patients and ongoing staff shortages. Talking to Neil and Richard, the pressures of the last few weeks are evident.
We've heard a lot in recent days about hospitals, operating at or over capacity. I mean, how's that impacting on you?
Yeah, we've had patients 8 hours in an ambulance waiting outside A&E to get in.
In the back of the ambulance?
In the back of the ambulance, so A&E's that busy that it's one in. We can only put one in when they get one moved out.
I mean, how ill would they be, a patient waiting 8 hours?
Generally, they're the relatively stable patients. If somebody is very sick, we will still put a standby on. They'll still be blue lighted to hospital, and they'll try and create space to get them straight into hospital. But the hospital only has so many resource cubicles. We've been on nights where there's meant to be 16 crews for Belfast and the southeast, and because of sickness and people having to isolate, we've maybe been down to half that capacity. And they can all be waiting at different A&E departments, and the calls keep coming in. We've went to emergency calls now, they're the lower category calls that have maybe been in 12, 13 hours before an ambulance has been able to get to their house. So it's been the next shift that has then attended that call from when it originally came in.
We're under-resourced. We don't have the numbers that we should have, and that's a battle, constant battle. Even laying aside sickness, illness.
And you've never known it to be this bad?
No.
No, I'm in the job for 14, coming into my 15th year. No, definitely not.
I'm 18 years and never seen it like this.
We've obtained official statistics that confirm the second wave of coronavirus cases is stretching emergency waiting times. On one day alone, the 3rd of November, an urgent Category 3 call took almost 18 hours to respond to, 9 times longer than the target time of 2 hours. A Category 1 life-threatening call, which should be responded to in 8 minutes, took over 45 minutes to get to. And in some cases, the arrival of the ambulance doesn't mean the end of the patient's wait. One urgent Category 2 patient had to wait almost 9 hours for admission to hospital. The Northern Ireland Ambulance Service said it apologises for any delays and promised to ensure that the sickest patients receive the quickest response. It said that delays carry an associated risk to patients who may be in life-threatening situations. The Department of Health said hospitals are under intense pressure. The department is clear that ambulances are not an extension of the hospital and should not be used in this way. Handover time should be kept to a minimum to ensure ambulance crews are available to respond to calls. In this second wave of the virus, the Northwest has been one of the hardest hit regions.
Derry City and Strabane District Council area now has the highest rate of infection in the whole of the UK.
Tighter restrictions were put in place there before the rest of Northern Ireland. In May, we filmed at Altnagelvin ICU in Londonderry.
No, that's okay. I just need to get my breathing right. Just if you feel so claustrophobic. Okay. That's you ready now?
The most critical patients were being treated there.
This has been strange times. The families used to come, hold patients' hand when they were recovering. So the nurses and the doctors become the family now.
One of those patients, Blian Bow, wasn't expected to live. He was put in an induced coma and was on a ventilator for more than 10 weeks, among the longest of anyone in the UK. His wife and children could only communicate with him via the staff. Remarkably, and against all the odds, he survived. We caught up with him and his wife Carla as he continues his long recovery at home.
I mean, how are you today? How are you feeling now, months on?
Things are going well. Obviously, there's still a lot of after effects in terms of sort of joint pain, things like that. It's very common apparently with COVID, so it's just learning to do that now and pick each day as it comes. But we're here, and that's the main thing.
What was it like at home for you and the children? Because your husband was so seriously ill. He was in an induced coma, and you couldn't get to see him.
It was just the worst experience of my life. It was awful. And you were worrying about your children, worrying about your husband, and just like myself, and just trying to keep it together.
At that point, the staff at Altnagelvin, they basically became your lifeline to Blaine.
Blaine was in a coma, but they were able to put the phone days a year where me and the children would have spoke to him. This was kind of our way of coping with things. We weren't aware whether Blaine was able to hear us or not, but for us, this was good for us to do.
How does it feel now hearing that, Blaine?
This Blaine's feeling a wee bit emotional here. He doesn't remember any of this, so it's kind of listening back from us telling the story of these things. You know, so it's tough for him to hear these things. Definitely.
In May, we filmed on the day Blaine's breathing tube was carefully removed as he woke from an induced coma after more than 2 months.
That's it all done. Is that it? Are you alright? In hospital? Are you still anywhere?
At one stage, Blaine was given his last rites, and we were told that Blaine wasn't going to survive because he was so ill. But it was amazing feeling. But there was just that wee fear still always there, you know, that it was going to be took away.
Has it renewed your hope, Blaine?
Definitely. It's makes you appreciate things a lot more. For being where you are, where you were, and where you are now. So, yeah, definitely has.
In the first wave, Altnagelvin ICU did not lose a single patient to COVID. We returned to the hospital earlier this month, and it was a very different situation, with 10 COVID patients in ICU, over 50 in the COVID wards, and a number of deaths. We spoke again to lead consultant Dr. Manav Bavzar.
When patients don't do well, that's heartbreaking. When patients don't survive, it's the most awful feeling as a healthcare worker. And we have lost few patients, and I've never felt so sorry when you see that, and that has happened this time.
Dr. Bavzar acknowledges that even with plans in place, the speed and volume of admissions in the second wave took them by surprise and has pushed the hospital to the limit.
And it did shock all of us, the increased transmission and how quickly that changed to a very rapid numbers of hospital admission. So whenever the numbers started to increase of COVID-19, we had to cut a lot of other services. And those patients, those folks waiting in the community are waiting for our care as well.
He says the second wave has reinforced the value of experienced and specialised critical care staff, who he says must be protected.
Biggest asset is your staff, but they are not finite number. We have got lots of nurses who have been recruited, but critical care itself takes a while to learn. So recruitment is an issue, but retention, according to me, is a bigger issue. And I think that's where, as policymaker, I will urge that we do something to retain our workforce.
The pressures on the healthcare system are taking their toll on workers. We've spoken to staff in the Greater Belfast area. Many of them say they are already exhausted, working back-to-back shifts, filling in behind colleagues who are off sick or self-isolating. In recent weeks, some have been transferred at short notice to work in acute areas where they say they feel anxious and overwhelmed.
The head of the Royal College of Nursing, Pat Cullen, says there's a current staffing crisis which has been 10 years in the making. Last year, her members joined other unions on strike, protesting against what they saw as unsafe staffing conditions and inadequate pay. She says COVID has made a bad situation much worse.
Things are worse now in the second wave for nurses. They are working 12-hour shifts without even a toilet break, with no food, no hydration. That's not unusual. It's what we're told every day. It isn't getting any easier for them, and they are exhausted, they are scared, and they're not feeling very safe at this moment in time.
Why don't they feel safe?
They don't feel safe because when they go in at night, they don't know how many staff they're going to have to look after their patients. They don't know that during the day either. They're being redeployed from ward to ward.
The Nightingale Hospital in Belfast was set up as the emergency facility for the 6 major hospitals in Northern Ireland to send COVID patients to if they exceed capacity. The 230-bed facility, part of the City Hospital tower block, is designed to provide a safety net to ensure the healthcare system here is not overrun.
We've spoken to several sources within the Nightingale unit, including support nurses recently deployed from other parts of the system, who say they simply do not have the experience or training to be there. They say support nurses are being transferred to the Nightingale with 1 day's basic awareness training.
One nurse from a non-ICU background working at the Nightingale has been redeployed more than 5 times since March to alleviate severe staffing shortages. She did not want to show her face on camera.
I had a 3-hour upskilling session in March where we went through the ABC of some basic nursing care, some basic emergency responses and how to troubleshoot a patient ventilator. And no further training since then. And while further upskilling training was available, we could not avail of it because we could not be released from the Nightingale numbers to attend. Any training we have had on the job.
In the first wave, many nurses responded to a call to volunteer at the Nightingale. But we've been told that in recent weeks, nursing teams have been redeployed from across the health sector to the unit with little or no negotiation with trust managers.
There are a lot of support nurses there, but some have worked in areas very far from the coalface of nursing for very many years, who are now coming into units where they're expected to manage pumps, infusions, equipment, ventilators. Some of them are fairly office-based or administrative, who are now working in a critical care unit. Some of the critical care nurses are coming from units within the trust, so have a year or 6 months experience. You have some fairly junior intensive care nurses who are supervising completely inexperienced support nurses, and the support nurses are on their knees with anxiety regarding the whole situation.
Our ICU nurses are highly specialised nurses, and it's not an easy place to work. They're not saying that they aren't thankful for the additional help they get, or they're not demeaning the skill of those other people. But what they are saying is that the added burden of trying to support those people, trying to care for those patients that are really very, very ill. And then at the same time, they're trying to support people who are anxious and scared about having to work in an ICU, have no ICU experience, and have never actually been in those environments up until now.
How did we get to that position?
We understand that this is not normal times, but we weren't in normal times to start with within the health service. We were already working within a crisis situation.
Some nurses have concerns about the impact working conditions could have on patient safety and are worried they could make a mistake. Hugh McAnoy from Unite Union says they've been contacted by anxious health workers. He believes more training should have taken place over the summer ahead of the second wave.
When the hospitals started to open up again, late May, from then till now, the question has to be asked of the Department of Health, what did you do during that time period to upskill your staff, to train your staff, knowing that a second wave would inevitably come?
Some nurses at the Nightingale told us they were surprised to see newly registered nurses just out of training at a one-day awareness course for the Nightingale unit. They say some of those working in the unit have not completed their initial 6 months training, known as preceptorship training.
Do you think in any circumstances that that's acceptable level of training to go into an ICU unit like Nightingale?
It's not acceptable. Nurses cannot just be moved from one area to another and given a day's training, because the pressure that places on then the specialist ICU nurses is enormous. But equally, what the nurses are most concerned about is the unsafe conditions that it creates for patients that they're looking after. That's the most important thing.
The Belfast Health and Social Care Trust said it was grateful to the large number of staff who have been asked to redeploy. It said without the continued dedication and flexibility of staff, it would not have been able to provide the required additional capacity for COVID-19 patients. It said all redeployed staff have been appropriately trained to ensure they can carry out their role safely, adding they work under close supervision of an experienced ICU nurse. It said clinicians and allied health professionals also work on the ward and all staff provide continued support. It said any staff member who feels they have not received enough training should speak to their line manager urgently. It's not just nurses who claim to have been pushed to breaking point. Dr. Tom Black is chairman of the BMA in Northern Ireland.
What I'm hearing from my members, from the doctors, is it's really difficult. They're changing into their scrubs in inadequate facilities. They're not getting rest facilities that they would expect to have. They're being redeployed without negotiation. They're having to work in conditions that they would prefer not to work in. And we all appreciate it's a pandemic, and we all appreciate it's once in a career environment. The system won't collapse, but the system will not be providing the service that patients would expect, and certainly that the professionals would hope to provide.
In response to Spotlight, the Health Minister said, "This pandemic has exposed the risks in underfunding health and social care and leaving it unprepared for unexpected shocks. The truth is that it has had a decade of being effectively run on empty." The virus has shone a particularly harsh light on staffing pressures that have built up over those 10 years. "I am committed to significantly increasing our workforce," but he added, "It takes years to train specialist staff. Time is a luxury. We just don't have at the minute." Tonight, the restrictions implemented by Stormont on the 16th of October to suppress the virus are still in place, extended after days of political acrimony at Stormont.
The executive has agreed a deal to keep the current COVID restrictions in place for another week.
But there will be a partial lifting of the measures this Friday. There are some signs they have worked, with the rate of infections slowing in most areas of Northern Ireland. But the Health Minister had this warning.
We haven't seen the decrease in the number of positive cases that we would have liked to have seen at this point in time. So do I think further restrictions will be necessary, will be asked for between now and Christmas? Yes, I do.
With many hospitals exceeding capacity, Tom Black says the interventions came much too late for the health service.
There was a fundamental error at the end of September, beginning of October. We needed a full lockdown at that stage for all of Northern Ireland. And the executive brought in measures which were too little, too late. It should be much stricter, much more severe. And we wouldn't be in the position we're in now if they had brought in much more severe restrictions.
At Queen's University, one virologist researching the spread of the virus is Professor Alton Power.
Purely from a scientific viewpoint, do you think that lives could have been saved if those restrictions had been introduced earlier?
Without a doubt, the less the transmission of the virus, the less people become infected. The less people become infected, eventually it will transmit to the people who are the most vulnerable, and therefore the less people that will actually die. That's clear. I mean, there's no ambiguity about that.
And you will also limit the number of hospitals operating close to or at capacity.
Absolutely, and not only that, the knock-on effect, obviously, if your health system is inundated with COVID patients, it's not capable of dealing with all the other patients that have to be dealt with as well. The executive has to look at it from the whole of society, and that obviously makes it much more complex to be able to get something that's balanced, that is capable of meeting the needs for everyone.
We asked the executive if there should have been an earlier lockdown. They didn't reply.
The restrictions are about to be partially lifted, but the pressures on the health service are not going away. Spotlight can reveal that the Department of Health have had discussions about the possibility of increasing the ratio of unregistered or inexperienced nurses working across the front line.
We understand that those discussions have looked at the possibility of raising the current ratio from 35% to as much as 50% across the health service, something that Pat Cullen says must not happen.
I'm aware that those discussions are being had, and every nurse in Northern Ireland would see that as a place where they will not go to.
Although Pat Cullen continues to oppose the increased ratio of unregistered nurses, she says she has been unable to prevent the use of mandatory redeployment.
I do know that managers within the system at the minute are trying their best to have voluntary redeployment, but when you have a workforce that has been so depleted, that has not been possible. So yes, there are conversations being had about mandating nurses to move. And let's not dress that up. Mandating means forcing nurses when they say, I do not feel comfortable about moving there. I don't feel I've got the skills. I do not feel I've got the experience. And that's what the nurses are saying to us. And then they're being told, well, you actually don't have a choice.
Last month, the Department of Health wrote to all healthcare workers saying the movement of staff would be voluntary. The department told Spotlight it is not considering an increase in the ratio of unregistered nurses to address severe staff shortages, but it said that anticipated increased staff absences may make it impossible to comply with optimum staffing levels. It said in those situations, nursing staff are required to exercise professional judgment to maximise knowledge and skills on the wards. The department added, extraordinary measures are required in extraordinary times. Winter always puts extra stress on the health service. This year, the pandemic has amplified that pressure beyond expectation. To the critically ill patients and their families, frontline workers remain a lifeline. Julie says she is fully reliant on doctors and nurses to continue to care for her elderly parents, both being treated for COVID in separate hospitals. She's back in self-isolation, but recovering.
Julie, where are you at now?
At the moment, my dad is still in the Down Hospital. They have him on a new antibiotic to try and keep the temperature down because his temperature keeps spiking. That's where we are with Dad.
Last time we saw your mum, she was being taken away to hospital.
She was allowed out on Friday. She got the all clear. But what happened was she went home and she had a fall. So the ambulance had to come back out and they took her back into the Ulster and she's back in the COVID ward. But I was speaking to the occupational therapist today and they're going to send her for rehabilitation so that she can get back up on her feet again.
Families are suffering in this second wave, But Blian Bow's recovery has been described as nothing short of miraculous. He's now looking forward to Christmas with his wife and family. They have a message for staff and those fighting COVID.
Looking back now, what would you say to the staff who looked after you all those months?
I think Mary Blian's just ever so grateful that all the staff in ICU and Altnagelvin, all the nurses, doctors, the whole team that's involved in the care of patients in ICU for basically saving his life. We as a family would like to thank them also because they give me my husband back and my children their father.
And what would your message be to families who have loved ones in hospital at the minute?
Stay strong. Keep the hope alive. As Carol always says, where there's life, there's hope.
COVID-19 has already stretched health workers to extraordinary lengths. Now they, and all of Northern Ireland, face an uncertain winter in which the health services capacity could be tested like never before.